With our officers being on the front line dealing currently with the challenges relating to addictions, overdose deaths, mental health, and homelessness that are present in our communities, we completely understand the need to consider every potential option. To be clear, though, the AACP does not support the decriminalization of personal amounts of illicit drugs in Alberta at this time. While we acknowledge that decriminalization of personal amounts of illicit drugs could at some point form part of an integrated approach to redirect persons who use drugs away from the criminal justice system and towards health supports and appropriate pathways of care, we do not believe the necessary health supports, including immediately accessible treatment services, are presently available for this purpose.
In 2021, there was a dramatic increase of drug overdose deaths in Medicine Hat, more than doubling the numbers experienced in 2020. The citizens of our city recognize the struggle people are having with drugs and addiction issues, and are looking for solutions that are effective in a move towards recovery. While the concept of decriminalizing drug possession may be one strategy in the overall fight against this public health issue, it cannot be a standalone or a singular response to this crisis.
Since the beginning of the opioid crisis, certain programs were developed that were for the majority of people. While Indigenous communities are very close-knit and the culture there is specific to them, we should start looking at actually going into the communities and getting more of an input from them. We're currently doing that at the Bloodshot Police Service, where we're in Blackfoot, it's called It Cannot Be, Mugono Dapi, the gentle way, the kind way. We're getting input from absolutely everybody in the community, and we're going to use that to create our own programs. And that is specific to our Blackfoot culture and our beliefs.
When we talk about decriminalization too, there's lots of discussion about what we would call safe supply or safer supply. We're talking about harmful drugs here, so they're not safe, period. But we're talking about toxicity in the drug supply that's causing some of the overdoses. And, we need to look at how that would be done. That may make some sense as well in certain circumstances. But again, it's very nuanced. We would want to make sure that anything we do actually addresses the illicit drug market. Because if it doesn't address the illicit drug market, then people are still going to be accessing toxic opioids. So again, a very complex subject that actually requires the attention of stakeholders at all levels. And so again, that's what we're advocating for, is those discussions, and a modernized framework could certainly be useful.